Hello friends, this is DrRBKushwaha, Associate Professor in the Division of Veterinary Clinical Complex FBSc and AH at SCOS, Jammu. Welcome to my YouTube channel, and if you are new to my channel, so kindly subscribe the channel and hit the bell icon for further notification. So today we have a 2 years old cow. So although from the height it appears that this is a calf, but when this cow was calf, so basically there was fracture of this humerus and this carpal joint. So because of that the growth was stunted, but this animal is presented for the swelling at the left lateral abdominal area. So you could see here, this is the swelling. So this is a soft swelling. So, and this swelling is persisting from the last 7 days. When I asked about the history of any trauma, so owner told me that he didn't notice any type of trauma. Then I asked about the by which this animal is tied. So he then told that he used to tie with the short bamboo stump. So normally we call khuta. So then I suspected that probably this animal fell on that stout stump, and that leads the blunt trauma to the this abdominal wall. So from that abdominal wall, so if such type of trauma occurred, so what happened initially, there was a rupture of the muscles, abdominal muscles, abdominal wall, and then slowly so there is a seepage of the fluid. So this whatever the you could see here, this is the all fluid. This is not any abdominal organ, and if you see, the fluid is also extended ventrally. It is in the region of the this umbilicus region also. So this is the admitted swelling you could see here. So from the lateral side, sometimes it is very difficult to palpate the ring, but when I press here, so it appears that there is a ring here. But this is not a classical hernia. In classical hernia, protrusion of the some abdominal organ. Since this is at the left side, so even if it is ruptured completely, so because of the rumen which is located towards the left side, so this rumen basically prevent any protrusion of the any visceral organ, particularly the intestine, omentum. So on the basis of this history, clinical examination, so we diagnose that this is a case of traumatic ventrolateral abdominal hernia, because it is at the lateral and the ventral aspect. Since this is the 7 days old, so margin of the, you can say, muscles is indurated, or it is the thickened. So if you see, this is the fluid, this is the fluid, this is not a gas, this is fluid. And owner also told that 5 days back the local vet aspirated the serosanguinous fluid from this area. So this is all about this case. So now we go for the surgical procedure. So we have diagnosed this case as a traumatic hernia, but when we made the incision, so we found that the peritoneum was intact, but above the peritoneum the all muscles they were torn and severely macerated, and the fluid was accumulated subcutaneously up to the vertebral column, means up to the here, up to this level. So fluid was collected. So we removed the fluid, and we sutured the whatever the muscles edges were present, whatever the muscles we found, we just sutured together with augmentation of the dead space, and then repair the skin in a simple interrupted pattern. Since lot of dead space was there, so then we apply the compressive bandage. So this is a 5-meter long cotton cloth. So we tightly wrapped around the trunk 3 or 4 times, and then finally secure with the adhesive tape, just to prevent the further accumulation of the fluid. This is a very important. Otherwise, even after doing surgery, if you leave as such, so there is again accumulation of the inflammatory fluid. So this is a very interesting case. Interesting in sense that from the clinical examination and as per the history, it was revealed that it could be a hernia. Although hernia was not classical type. So the whatever the swelling we seen before the surgery, so that was basically because of the trauma at the muscles, because of the rupture of the muscles, and continuous movement from the last 7 days, because animal was not given rest. So it was basically probably hematoma, then further converted into the serosum venous fluid. So this is how we manage this case. So overall, we just given the incision to the swollen area, drained the fluid, applied the suture, then we did the compressive bandaging. So thank you for watching this video, and if you like this video, so kindly share with your friends or veterinarian, and if you have not subscribed this channel, so kindly subscribe the channel.